Let's talk about 10 major risk factors for diabetes. Number one is your age. If you're age 40 years or older, that increases your risk for diabetes. Number two is family history. If you have family history, so meaning your parents or your siblings have diabetes, that increases your risk as well. Number three is being overweight or obese, particularly if you have truncal obesity, meaning you have a lot of weight around your midsection. That increases your risk for diabetes significantly. Number four is living a sedentary lifestyle, so meaning you have low activity level or no activity level. For someone who doesn't move around a lot, someone who doesn't exercise or do any endurance activity, that increases the risk of diabetes. Number five is unhealthy diet, so meaning foods that are high in sugar, processed foods, and refined carbohydrates, also sugary drinks. Number six is history of gestational diabetes. So if you had gestational diabetes even after giving birth, down the line you could develop diabetes. You are at an increased risk of developing diabetes. Number seven is your ethnicity. So people from African descent or people of African descent, Hispanic, and some Native Americans are at higher risk of developing diabetes. Number eight is women who have a history of PCOS. This is as you know, diabetes is a endocrine disorder, and so is PCOS. So if you have a history of PCOS or if you suffer from PCOS, that also increases your risk of developing diabetes. Number nine, if you smoke or drink alcohol, that also increase your risk of developing diabetes. So consider reducing how much you smoke as well as quitting. Number 10, and the most tangible risk factor, is prediabetes. So if your A1C, which is the average blood sugar over a period of 3 months, you can get checked when you go to your doctor. And if it's above a certain limit, then you're considered pre-diabetic. If you are pre-diabetic, you might as well consider yourself a diabetic. This can be reversible depending on your